When you prescribe intravenous infusions in e-care, it's rather annoying if you find they've subsequently fallen off the drug chart before they have even been given. This happens if, having been prescribed, the predicted finish time of the infusion is passed before the infusion has actually been started. So you can see why this is unlikely to be a problem for an 8-hourly or 12-hourly bag of fluids, but it's a real risk for something prescribed over an hour or less. Just to demonstrate this, we'll have a look at a test patient. If we look at this patient who's recently been admitted and go to their orders, you can see that I have ordered a continuous infusion of sodium chloride, 500 mils at a rate of 500 mils per hour. This was scheduled to start at 19 minutes past 2. For a comparison, I've also ordered at the same time sodium chloride using the short infusion order, which I shall show you more of in a minute. Similarly, 500 mils of fluid as an intravenous infusion over 60 minutes. Again, due to start at 19 minutes past 2. If we look at the patient's drug chart, you can see both of the orders, the only difference being the standard continuous infusion appears under continuous, whereas the short infusion appears in the scheduled medication section. If I was the nurse for this patient and I went to the medication administration wizard, I would see both of these prescriptions due to be given. Note that currently the time is 24 minutes past 2. Suppose for whatever reason neither of these infusions gets started. Let's see what will happen an hour after the order was issued, i.e. the time we would have expected in an ideal world these infusions to complete. So we're in the same patient's record, but you'll notice time has moved on. It's now 4:34. I can tell you that neither of the infusions was started. But looking in the medication administration wizard now, we only see the short infusion available to give. That continuous infusion has disappeared. If we close them and go to the drug chart, if I have all active medications shown, then I see the short infusion, but no sign of my previous continuous infusion. I can only see this if I select all medication in the system, and we can see that it's been greyed out and automatically discontinued despite the fact it's not been given. Indeed, this happened exactly an hour after I prescribed it because it had not been given. So for your short infusions, be sure to use the short infusion order. Your access is in the same place as your other orders, and it's available for both normal saline and plasma light. And if you need to make additives to either of these, you can do so in the usual way. So if I'm searching for sodium chloride, I just need to go a little bit further down the list here to the short infusions. You then fill in the missing details, again much in the usual way. It'll ask me over what timescale do I want this. So in this example, let's have 500 ml of saline in 30 minutes. So remember, use the short infusion orders for infusions of an hour or less, and there'll be no risk that they fall off the drug chart if they're a bit late in getting started. Don't be tempted to use the short infusion order for longer infusion rates, as when the infusion is started, the entire volume prescribed will automatically be entered into that hour of the fluid balance chart. So for example, on an 8 or 12 hourly bag, this could lead to quite a significantly misleading fluid balance chart.